It came out that more than 23,000 Canadians died waiting for medical care last year. And that's an increase of 3% year over year.
It's in 2026. 2026.
My MRI to see if I have a brain tumor is in 2026. It's March 2025 right now. And
Cool. I get there at 6 o'clock. And this is 45 minutes away from me. So I'm driving there after work. At 6 o'clock, I get there and she's like, no, we're done for the day. He's already seen 20 patients, so he can't see anymore. And I'm like,
you either have to wait a decade to get an appointment to see a doctor, or when you actually see a doctor, I'm convinced some of them literally have just walked off the street.
Many Canadians will cross over into Buffalo, for example, for a simple MRI because the wait time in Canada is months.
Your kid has an emergency, so you decide to drive to a children's hospital. 6+ hour wait times.
Each one of them is either closed for the day or says I have to make an appointment. What is the point of having a walk-in clinic that you need to make an appointment at?
The wait time has been over 6 months. I can send you to Richmond, which could be a little faster, but I don't think it is going to be faster than 4 or 5 months.
God knows how long. 7-month long process if I'm being optimistic. Probably longer than that if I'm being realistic.
I'm genuinely about to start crashing out just about the dental system and the medical system that is Ontario and that is Canada. I have an urgent issue and I've called maybe like 50-60 different places and different times of getting some sort of issue resolvement or someone to fix this, and literally no one knows what they're doing. My family doctor doesn't know what he's doing. The receptionists don't know what they're doing. The dentist does not know where to take me or where to guide me. Major hospitals like Etobicoke General do not know what the hell is going on. And I don't know. I feel like I'm crashing out. Like, I feel like no one knows what they're doing, and we're paying a bunch of taxes. We're paying a bunch of money into this system, and it just doesn't work. It doesn't work. I get it. Like, back in the day, I used to think like, oh, it's still fine. It's slow, blah, 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 blah. It's better than blah, blah, blah. And like, it's so infuriating. It's so frustrating. Like, no one... I need to calm down. Okay, I've calmed down a little bit. So here's some background. I went for a regular filling. I get a lot of cavities back in December, like near the end, holiday season, I understand. Use up whatever benefits I had. They do some x-rays and just randomly, just to use up the insurance coverage, I guess. And they find that I have a cyst that's pushing my wisdom tooth into potentially nerves. I haven't had any symptoms, but 2 dentists looked at that x-ray and went like, whoa, you need to get this taken care of right away. So I'm like, what the heck? Like, I'm going on a 3-week vacation, a honeymoon. Like, I don't have time to get this taken care of. So before I leave, I have to get a CT scan to get a better picture of it. And the CT scan is not covered. So I have to pay like $250 out of pocket to get it done. And even getting that CT scan, I had to call around 20 different places because it's only done in certain clinics. And only one dentist at that clinic is authorized to do it. So after looking around like 20 different places I called, like I find one person that does it. It's the holidays, I understand, and I get it done. Pay the money, get it done, and my dentist has been saying this is super urgent. So I tell them like, hey, quickly, please send it over. Once I'm back, January 25th or so, I reach out to them, be like, my dentist, original one, be like, hey, did you guys get the CT scan? And they're like, no, we don't have anything. And I'm like, I told you guys to check, and like, it's an urgent thing, call me, like email me because I'm gonna be out of the country. She doesn't have anything. So I called the CT place. They're like, we sent it January 7th. So within a week, they already sent it. Then I called the other lady back. She's like, yeah, we do have it magically. So they have it, and I'm like, okay, I don't see why no one contacted me. She's like, okay, come and see a surgeon and you'll have to do a consult. This is late January, I think, like January 26th, 27th, and I can't see the surgeon until February 9th because he's away. Mind you, this is an urgent issue. 2 people have already freaked out saying like, you need to get this taken care of ASAP. So anyway, I go do the consult and the surgeon's like, yeah, hey, we can operate, but there might be some issues because the CT wasn't done right. what do you mean it wasn't done right? Like, and I've already paid for the CT and I don't want to pay for another one because it's going to take more time and more money. So the CT, they're saying like, we don't know how deep this goes, and go back to that clinic and tell them to do it again for free. Like, they're not going to do it for free. Like, who's doing this for free? Like, okay. Calm down. So yeah, they're like, we're not gonna like I don't think we should operate. It might be there might be complication if we do it here. It's better you go to a hospital. So I'm like, okay, I guess I go to a hospital. So how do I get there? And my dentist is saying, if I give you the referral, you're gonna have to pay like $2,000 to $3,000, if not more, to get this done. So go to your family doctor and have them write the referral so that they can fast track you to get this handled because it's urgent. One thing about my family doctor is they only work 3 hours a day. Maybe one other time slot at like one of the days, but 9 to 12, that's it. Monday to Friday, Saturday, that's it. So Tuesday I blow up their phone because I know they're working. Their hours are not posted online. There's no information. You kind of try your luck and you'll see if you get in. So I spam them Tuesday, 9 o'clock, 40 calls. I know, Siki, crazy, because I'm going crazy. Okay, yeah, I'm crazy. No one picks up. No one calls me. So I call the next day. Again, I think I have to call a few times for them to like get back to me. And I think she says she has a 5 to 7 time slot that the doctor's gonna be in. I'm like, okay, book me in. She's like, no, we only do walk-ins at that time. He just sees whoever's there. Cool. I get there at 6 o'clock. And this is 45 minutes away from me. So I'm driving there after work. At 6 o'clock I get there and she's like, no, we're done for the day. He's already seen 20 patients, so he can't see anymore. And I'm like,
Today on How Fucked is Canadian Healthcare, I need an MRI to see if I have a fucking brain tumor. And go ahead, guess when it is. Go ahead, guess.
It's in 2026. 2026.
My MRI to see if I have a brain tumor is in 2026. It's March 2025 right now. And if you thought this was bad, it's actually worse than you thought, because the appointment where we decided that I need this MRI was in December of last year. So it's not like it's 10 months from now, it's 13 months. It's a 13-month wait to see if I have a brain tumor. At first, I just thought this was a mistake because having an MRI every year is like a monitoring timeline. Like I already have an MRI every year for my spine tumor, which is why we think maybe I have a brain tumor too. So I was like, okay, they just made a mistake and scheduled this on a monitoring timeline. But no, I called and the clinic was like, yeah, the doctor actually requested that you have it earlier, but this is the next spot we have. We're seeing about 13 months for these brain and spine MRIs. Cool. Canada, where healthcare is free, but only if you can afford to wait.
All of this, something has to change. And don't tell me there's no money for it, because there is. We pay for it. Let's talk about the approximate 13% of Canada's GDP that goes towards healthcare. That's about $300 billion annually. What are the subsections of healthcare that are the main focus of this expenditure? I'll tell you what's not. It certainly isn't staffing, as we know how severely understaffed hospitals and clinics are. Remember those wild ER and referral wait times I was talking about? Or the lack of overnight emerge doc? Or the shortage of family doctors? When people aren't compensated fairly, they don't show up the way that they're supposed to, both literally and figuratively. In terms of the latter, those that do physically show up are often overworked and frustrated at their circumstances. And all of this creates the perfect storm of long wait times, most urgently for those in need of critical life-saving care.
Welcome to Canada, where we have free healthcare. Now I'm going to tell you what comes along with that free healthcare, because friends, nothing in this life is for free. As a Canadian who's lived in Canada most of my life, wasn't born here, but I was raised here, I will tell you that free healthcare is not as great as you may think. In fact, I think it's actually named incorrectly, and it should be named free emergency care, where if you have a very serious emergency and you need surgery, yes, it is free. But my friends, that's also named incorrectly, because our taxes are so damn high in this country that you're already paying for it. Want to know what else you get with free healthcare in Canada? Long ass waiting times everywhere. Want to go see your doctor? Especially during cold and flu season? Prepare yourself to wait 2 to 3 hours, sometimes even more. Your kid has an emergency, so you decide to drive to a children's hospital. 6+ hour wait times just to be seen. That doesn't count the diagnostic and anything else that needs to be done if your child needs anything else. Want to see a specialist? You can't. Your doctor has to refer you to the specialist. And the government monitors how many times your doctor refers you to XYZ places, so your doctor is very cautious of where to send you. Sometimes, most times, not sending you at all. Children don't have pediatricians here unless they have a problem. And when you do finally get a referral for a specialist, your wait time is anywhere between 3 to 8 months to see the specialist. And then when you finally see the specialist, the wait time if you need some sort of surgery or procedure is another 3 to 8 months. I don't know about y'all, but for a citizen of this country that pays up in taxes, I find these wait times absolutely atrocious, unacceptable, and disgusting. Now, I'm not just telling you these things because I heard some people talk about it. I'm telling you these things because I have personally lived it. So I don't know about y'all, but I think this shit's criminal. Healthcare in Canada is not free. You're paying taxes, very high taxes, but you're not seeing the result of that. So the next time some Canadian tells you that they're so proud to have free healthcare system, ask them if they have a brain.
I've been to 3 different walk-in clinics trying to figure out what's going on with my back. Each one of them is either closed for the day or says I have to make an appointment. What is the point of having a walk-in clinic that you need to make an appointment at? Like, something needs to change in this country and the medical, because this is ridiculous. I am tired. I'm so tired of this. Man, I wish there was a paid option. I really do. I'm not saying I don't appreciate the ability to be able to go to the hospital, but when it comes to everyday matters, I wish there was a paid option so I could just see somebody and get diagnosed and get shit done, because the longer this goes on, see, it's like a spasm that I keep getting, and these like electric pains, like, oh my God.
So I know this is not going anywhere, but I just need to vent. I have been having like pain on my right foot for like 6 months, over 6 months. And I thought it was because of work, because it hurts when I lift because of the pedal, right? And then I was taking anti-inflammatories, didn't help. Then I went to Greece for 3 weeks. I didn't work. I thought it was going to get better. It didn't. So then I went to the doctor and I had an x-ray done. And then it was found that I have an injury in on one of my bones. So the bone was supposed to be like a little square, and it has like a depression. And then, so then I was like, okay, how are we going to fix this? And they were like, oh, I have to send you to a specialist. And then he says, the wait time has been over 6 months. I can send you to Richmond, could be a little faster, but I don't think it is going to be faster than 4 or 5 months. I just don't understand how this stupid health system in Canada, like a first world country, how is this stupid? Like, I don't want to wait. I want to have this fixed. I have pain every day. I work. I need my foot to work. And I cannot go to a doctor. I cannot pay and see someone privately. I have to wait 4, 5, 6, 10 months, a year, because I don't have the option to go see someone. So now either I suck it up with pain every single day, because anti-inflammatories are not doing anything, not working is not doing anything, and because or I have to go to Brazil, or I have to go to the US to have it done, because I don't freaking have like an option to have it done here. How stupid is this? Tell me about it. I don't understand. I do not understand. How stupid is this? Oh, but it's not an emergency. You are not going to die. You are not dying from it. Oh, so I have to be dying to then be seen by someone. Very smart, very beautiful. I actually have a friend that lost his mom because they didn't do the stuff that they were supposed to do, because nothing was like giving symptoms, or they, I don't know, they forgot to take the freaking exams, and she died from that. So thanks for listening to me venting.
What the fuck, Canada? This is so grim. It came out that more than 23,000 Canadians died waiting for medical care last year. And that's an increase of 3% year over year. And by the way, we're at over 100,000 people since 2018 who've died waiting for care. The worst offenders are, no surprise, Ontario #1 and Quebec #2. And then after that, you have the list of the other provinces. And before you come at me saying that we need to spend more money on healthcare to fix this issue, wrong, because we are at an all-time high, historical high of $244 billion a year spending. By the way, this represents $6,000 per person per year, which is an increase of threefold over what it was in 1990. We rank as one of the highest per capita medical spending in the G7, and yet we fall behind everyone in terms of doctors per capita, MRI machines per capita, beds per capita. And of course, our wait times are some of the highest in the developed world. And let that be a cautionary tale to the Americans who look up north thinking that our single-payer healthcare system is the best. Guys, you have it much better down there. And don't let Canadians who are brainwashed into thinking they have the best system ever tell you otherwise. Canada falls behind Germany, Switzerland, France, Sweden, Finland in terms of healthcare, and we pay more than all of them. And to Canadians, it's about time you wake up. The system is completely screwed up. And guess what? It ain't getting any better.
When I tell people I live in Canada, they go, "Oh, you live in Canada? So you have free healthcare." Yeah, we do, but there's a reason it's free. You either have to wait a decade to get an appointment to see a doctor, or when you actually see a doctor, I'm convinced some of them literally have just walked off the street. I just went to get my ear flushed out. If you don't know what that is, if you have wax build up in your ear, which I knew I did, then you just rinse it out. Straightforward, right? I even told him I think it's a bit infected. He's like, "Well, why do you think that?" This is TMI, but when I put my finger in my ear and I smell it, it smells weird. And I've been getting these migraines for the past 2 days, so I know it was infected. I know it was getting bad. You know your own body. He comes back with like the machine that they flush the water in your ear to rinse it out. Just before I do this, I just want to let you know that you could experience trauma. Excuse me? I've had my ear cleaned out many times. I've done this before. So this has never been a thing that a doctor has ever said to me. So at this point, I'm a little bit scared, I'm not gonna lie, but I'm desperate to get my ear cleaned out. I'm already here. I waited for this damn appointment. I'm getting my ear flushed out. He starts rinsing it, and I actually physically felt the earwax plop out. But then he just kept going. He just kept putting the water, even though the earwax clearly came out of my ear. And he kept pumping it. And then my face went like, and then he goes, "Oh, sorry. And then he stops. And he goes, "Let's check to see if the wax is all out of your ear." So he puts the light back in my ear and he's like looking through the thing. "Okay, it's all clear. You're good." "Oh, okay, so that's it?" And he goes, "You're good." Then I asked him, "Is it infected?" Like I felt like it was infected. My ear's been itchy. It's been really sore. He cuts me off mid-sentence and goes, "Nope, you're good." He then rushes out of the room and I'm like, "Well, thank you. Now I can hear properly." And he laughs. I'm putting my earrings back in my ear because I just don't want to lose them. So I'm putting them slowly back in my ear. Thank God I did, because I see blood dripping out of my ear. I can see the blood as I'm putting the earrings back in. And my face is like, I can hear him rummaging down the hall. So I literally walk down the hall and I'm like, excuse me, my ear is bleeding. I show him and he goes, "Oh, okay, just go back to my room and wait there." So I'm sitting in his room waiting for him to come back. He then comes back and he looks at my ear, doesn't even wipe the blood first. He just puts the light right in my ear, hard, like puts that ear thing. Is looking in there a long time with the light. He has the light on and he's looking at my ear, to the point that I then ask him, "Does everything look good?" Like I'm kind of concerned at this point. And he goes, "Oh, no, you're good. It's just a little bruise right in the back corner right there." "Okay, is that normal from flushing it out?" He goes, "No, it's caused from the he couldn't remember the name. He couldn't remember the name of the thing that he used in my ear. The flusher out thing. He just was stuttering. And I'm staring at him like, dude, do you know what you're doing? He goes, no, the plastic tip on the thing that I put in your ear, it literally just cut your ear, just on the kind of inside right there. There's just a little bruise, but it's fine. It'll heal on its own. You're good. You know what's funny? I've had my ear cleaned out before, and the last doctor I went to see, my ear did bleed just a tiny bit. And she was like, oh, that could easily get infected. Let me give you some ear infection drops so it doesn't get infected. Knowing this, I then said to him, I have some ear infection drops. Should I be putting those in just to like prevent infection, blah, blah. He goes, you're good. You don't need it. You know, if you need it, just come back. Bro, I ain't coming back to see you, period. Period. You just fucked up my ear. My ear was freaking bleeding. He blots it a little bit. He's like, you're good to go. Nah, I don't even know how some of these people are doctors. I really don't.
I moved from Toronto, Canada to South Florida almost 3 years ago, and let's talk about healthcare. I get asked this question all the time. The Canadian healthcare system sucks. It doesn't just suck. It's terrible now. It is horrendous now. And contrary to popular belief in the United States, it is not free. The taxes that Canadians pay are so much higher than what they pay in the United States. And that comment, both of those comments about the Canadian healthcare system sucking and the taxes always trigger people, and people always fight me in the comments. Anyway, the Canadian healthcare system as it is right now is absolutely atrocious. For anybody who truly needs the system for very important things, it has failed so many people. And every single Canadian knows somebody who had, and somebody close to them, if not themselves, a terrible experience within the system. The wait times are insane. If you're not like on death's door, you're not going to get treatment for a lot of things. And it's not because the doctors are bad or anything like that. It's there's no money. Guys, the socialist, like universal healthcare system that Canada has in place doesn't have enough money. And the people suffer significantly. I've seen it with my mom. I've seen it with my dad. I've seen it with my best friend. It's wild. A lot of rich people, especially if they live close to the border, the US border, they will pay out of pocket to go be seen in a US hospital or clinic like the Cleveland Clinic or the Mayo Clinic. Many Canadians will cross over into Buffalo, for example, for a simple MRI because the wait time in Canada is months. The wait time for an ENT for your child is months. The system is failing, and Canadians are still paying an enormous amount of taxes. So then people say, well, what about having to pay for private insurance in the US? And to that, I have two responses. The first one is I've learned that most Americans have pretty good coverage from whatever company they work for. And yes, sometimes they have to opt in to get better care, but it's still better than Canada. And two, for those people who don't have that ability, but are paying out of pocket for private health insurance, the money that you save not paying a high tax rate in Canada more than covers whatever you're paying on a monthly basis to have private health insurance. And I also understand, I've already had this experience a couple of times, how insurance companies, health insurance companies in particular, are such a scam, and they really try to squeeze people, and you absolutely have to be very diligent. I would still pick this over that.
Hi friends, if you live in Canada, you need to watch this video, and some of you from other countries might also find this interesting. So my name is Dr. Carter. I'm a physician with specialties in internal medicine and rheumatology, and you may or may not know, but healthcare in this country is truly falling apart, and I feel like it's not getting the attention it deserves. And I am fortunate to have this platform, so I thought I would use it to help spread the word and see if we can gain support, because if things do not change soon, I really fear we're at a breaking point. And now I work in the province of Alberta, so I'm going to speak mainly from my perspective, but I understand that it's even worse in certain provinces and other provinces, so I can't even imagine how bad it is. But I'm just going to give you a few statistics. For example, if you need a hip or knee replacement in Calgary, where I work, the wait to even meet the doctor, just to have the initial consult, is 28 months, and then to have surgery, it's going to be another 6 to 12 months after that. And it keeps getting worse and worse. As a rheumatologist, the wait list in Calgary to see a rheumatologist, we have almost 4,000 people on our wait list. And you'd think that the government would be doing things to try to help physicians and help the healthcare system, but instead they keep making more and more cuts and making it more and more difficult for us healthcare workers. For example, in Alberta, the province where I work, the government has just proposed cuts to our on-call stipends. So they're either drastically reducing the amount of money that we make on call or just cutting the stipends altogether, expecting doctors to work for free. For example, for our specialty, from the hours of 7 p.m. to 5 a.m. when we're on call, starting April 1st, we will now make $20, period. Not $20 an hour, $20, period. And some specialties won't make any money at all when they're on call. Now, other provinces are actually doing things to increase physician payments, but for some reason, the Alberta government is going the opposite direction and decreasing how much we make. Now, being on call is extremely stressful. When we do it as rheumatologists, we're on call 24/7 for 7 days straight. So it's very exhausting. It's extremely stressful. And then to only be paid $20 to work for 10 hours, it's honestly a joke. So what do we need? We need your help. We need you to write to your government officials, let them know that you support your healthcare workers, because without more attention and more feedback from constituents, nothing is going to change, and the system is just going to keep getting worse and worse and worse. And we're going to keep losing more and more doctors. I have many colleagues who have quit medicine altogether in the last year. For example, one is going back to law school to be a lawyer, and other doctors are leaving for other countries and other provinces where they're getting paid better. So we don't want this to happen. And so if you could please help, we would be so grateful. So please make sure you share this video and lend your support. Thank you, friends.
The Canadian healthcare system will quite literally be the death of me, because I truly am just baffled by how things work here, and I can't express how frustrated I am and how much pain I am and just how done I am with like how it works over here. Okay, basically, to put into perspective for you, I have endometriosis. It's very advanced. Okay, when I got diagnosed, it was spread outside of my pelvis, outside of my uterus. It was to my bladder. Okay, so I have endometriosis pretty much everywhere in my abdomen, lower pelvic region, okay? And so since then, I was put on a medication called Bizan to kind of like put my symptoms at bay, hopefully stop the endo from growing, and it did for quite a while, and I was really happy about that, kept my symptoms at bay. But within the last year, I've had this constant pain in my left side of my pelvis / abdomen, and it like significantly protrudes more than the right side. Okay, so I knew that something was wrong. I knew that something was there. Had an MRI done. There was a cyst there on that side, the size of a lime, and I'm quite mini. Okay, so like if something's inside of me, no shot, it's gonna show. Like it's gonna be inflamed and it's gonna protrude more than the other side. So whatever, that tracks. And then a couple months ago, I had an appointment with my specialist, my gynecologist, who's also a surgeon, specialist in endo. And she suggested we can put you on hormone-induced menopause because that's the only other option. In terms of medication, there's nothing stronger than Bizan. She suggested that the IUD would only be effective if my endometriosis was cleared out of me first. So I said, okay, what if we do surgery? And she said, we can do that. We can put you in for surgery and excision, like do an excision surgery on like whatever's there, remove that cyst. And I'm like, okay, great. So in the meantime, she sends me for an ultrasound, and she says I need the all clear from my surgeon first before going into the surgery, and on top of that, he needs to be there the day of because of my bowel complications and stuff. Like, he needs to be there in case of anything. So I'm like, okay, great, that's no problem at all, whatever. The referral was sent for my surgeon, who I am actively a patient of that day. Okay, I understand that in Canada, like, you need a whole different referral for a whole different issue, regardless of the fact that you may be a patient of that specialist already. So I was like, oh my god, this is going to delay the process so much because I'm going to have to like be like put on the whole referral list and that kind of thing specifically for this issue. That's not the problem. The problem is getting through to my surgeon's office. I called the day of that the referral was sent and I said, heads up, this is being sent. I'm already a patient of his. Is there any way we could expedite it because the pain is so excruciating? I need to be seen ASAP so that I can go on the list for surgery. And they were like, we didn't receive anything. That was April 7th, okay? So the other day, I'm at my hospital downtown Toronto, an hour away from my house, and I'm like, I'm here for an appointment already. Oh yeah, because I went to the ER over the weekend because the pain was absolutely excruciating. I didn't know what else to do. So I went to the ER hoping that like maybe they could just do an ultrasound and see like, is there anything concerning that needs to be treated like immediately, okay? So that trip to the ER was pointless. Like pointless because they didn't even have an ultrasound tech overnight, and it was like 7 p.m. and the ultrasound tech had already left, so whatever. Then they booked me for an emergency outpatient ultrasound on the Monday, so this past Monday. So I go in, have the ultrasound done, whatever, and then while I'm there, I'm like, I'm gonna go to my gynecologist office and to my surgeon, my colorectal surgeon's office, to see like what's the process with that, like the update with that referral. Okay, I'm like hopeful that I'm gonna get through to somebody at my colorectal surgeon's office, because I've been calling and they never pick up the phone. Emailing, never like replied. Like, oh my god. Okay, so I'm there and I'm like so hopeful. I sit down to talk to the secretary and she's like, oh yeah, their admin isn't in today. It says that they're here in the system, but they're not here today. And I'm like, great, okay. So I was like, whatever. I just took the L and I walked away, and then I went to my gynecologist's office and I asked them, like, what's the update with the referral? And they're like, oh, we sent it, but we haven't heard back from your surgeon. And I'm like, I know that you guys sent it. I know that you did. And they said that they would send it again. But right now I'm waiting for that appointment with my surgeon so that he can give me the all clear. And then I need to have a follow-up appointment with my gynecologist surgeon so that she can actually like tell me what the plan exact is, and then I get put on the list for surgery. In other words, this is going to be like a God knows how long, 7-month long process if I'm being optimistic, probably longer than that if I'm being realistic. Like I can't, like if it were up to me, I would literally spend any amount of money on a surgery right now at this point. Pay out of pocket. I wish I could go the private route, but like Canada just doesn't work like that. And I'm just so beyond frustrated because I cannot function like this.